Hey guys, good evening. Welcome to the class. How's the exam preparation coming on? Hey guys, come on. Good evening. By now you already know what we are doing in these lectures, in these sessions. So basically, we are going through the concepts, brushing through the concepts, and also by the end we practice what questions or what topics are important from the examination point of view, right? So today we are dealing with a very important chapter, that is why do we fall ill. Right. So let's start and dig into the chapter and find out what should we be aware of, what shouldn't we miss from the chapter from the examination point of view, right? Okay. Before we do that, it's again a way of revisiting the weightage, right? So organization in the living world is 20, right? Then our environment is 6 and food is 4. So these are the chapters or units, I should say, that cover your biology portion. That means 30% weightage. We discuss this in each class as well. Monish, I won't be able to read out the chats, but I will have a look, and if there's a question that's important, I'll make sure that I discuss it. Okay. Okay. So let's start this chapter with the very first discussion of health and disease, right? So this chapter requires you to know the difference between health and disease. So while health is the complete mental, social, and physical well-being, disease is existence of discomfort, right? So we need to understand the difference. So what's mental, what's physical, what's social, what's the difference between mental and social? So mental is your capacity to perceive your surroundings, right? Whereas social is your capacity to react to the information that you receive from your surroundings, right? For example, if a friend is coming towards me, if I'm unable to understand that, that's mental. But if I know that I need to put forward my hand and shake as in a way to greet him, that's social, right? So all of that comes under a good health, while diseases offer you discomfort, right? Some or the other biological systems don't function properly and you get a disease which starts to show as symptoms. Now, it would be wise if you know the difference between symptoms and signs, right? So symptoms are something that you report, that's to a doctor. Maybe you say you're having a headache or you're not feeling well, and the doctor will measure the temperature maybe, and if it's more than 98.6 Fahrenheit, he will say, oh, you have a fever, probably you might be having an infection, right? So sign is something that a doctor measures. It's a measurable quantity. Symptom is something that you report to the doctor. Okay. Now, diseases, we divide diseases, okay, according to the duration that they persist, that is acute and chronic, right? Acute are the ones that remain or that persist for a very short duration. Maybe an influenza infection is, it can be an example, which passes on in like 5 to 7 days. Chronic, on the other hand, is something that prolongs for long periods, maybe around 3 months, right? So that is something that we call chronic, right? Now, chronic examples can be TB. Okay, so chronic example can be TB, right? It can be cancer. All these persist for long periods of time, right? Diabetes is another chronic disease. Now, we can also divide diseases on the basis of infectious or non-infectious. See, when I mean chronic, that simply means something that protracts for a longer duration, maybe 3 months or more. So diabetes includes in that. Okay, now causative agent can be divided on the basis of infectious and means the diseases, the causes of diseases can be divided on the basis of infectious and non-infectious. So infectious diseases are those which spreads from one to another, right? And non-infectious are those which can't be spread. For example, cancer is a non-infectious disease, right? You can't spread a cancer from one person to another by shaking a hand, by blood transfusions. But infectious diseases, on the other hand, do spread like that, right? So infectious diseases can be spread. For example, someone was talking about typhoid. Typhoid is something that spreads via food and water, right? So most of the infectious diseases, they are caused by some or the other pathogen, and these are the ones that spread, right? Yes, chickenpox is infectious, Shashank. Okay, now we because we know that certain diseases like infectious diseases are transmissible, are communicable, they can be transferred from one organism to the other. We also study the mode of transmission for them. And you will be wise to at least remember one example each. Okay, so food. So typhoid is something that can spread by food, or there are other diseases that can spread via food. For example, by eating uncooked poultry, even certain viruses, as you understand, the swine flu easily spreads like that, right? Yes, AIDS is infectious, Aryan, very much. Okay, now certain diseases do spread by via blood. AIDS is one of the example in this category. Okay, so AIDS can spread via blood as well as sexual contact. So while establishing a sexual unprotected sexual contact, AIDS has a chance to spread. Now size, because of the size of the pathogenic particles, certain diseases spread via air as well, right? So because they are very small, they can linger around in the air for larger periods of time and have a chance to be taken in by another person. For example, let's say I'm having influenza, okay, or simply right, I'm having a disease, let's say influenza. Yeah, let's take influenza, and I go to gym and I start exercising there. So I will be emitting a large volume, a large concentration of pathogens from my uh, mouth, and a person doing exercise close to me can take them inside and get the disease as well, right? So because of the property of size, those can be spread, right? Non-infectious diseases are drishti or many, like cancer is non-infectious, right? Certain genetic diseases are non-infectious, they can't be spread, right? Now a certain diseases concerned with the nervous system are like schizophrenia. They are not transmitted via they are non-infectious. Okay, HIV is not by contact, Shashank. This is a very great. It's only by sexual contact or blood. It's not by contact. You don't get HIVs by shaking hands with people or by eating with them. Okay, now so contact, many diseases do spread via contact, and most of them are fungal. Many fungal diseases, they spread via contact. You should remember a few names, right? Like ringworm, athlete's food. So you should remember them. Water, again, as we discussed, typhoid is one of them. Vectors, this is something that's important. Why? Because you are sometimes asked about a disease and its vector, so you should remember about Aedes, which transmits dengue, right? And you should also remember about Anopheles, right? Anopheles is a transmitter of malaria. That's correct, right? So you should try to remember a few examples. Now, few, that doesn't mean you remember the whole stack. You don't need that. Okay, so you can get many vectors, but you don't need to remember all of them. But you should remember a few examples. Okay, now treatment. Now, how do we treat diseases? Now, in treating diseases, we have two methodologies. Certain times we kill the cause, we kill the cause, and certain time we manage the symptoms, right? So we have the drugs. The drugs can do either of two jobs. We can either manage the symptoms or we can treat or kill the cause itself. Now, in every case, killing the cause is not ideal or it's not possible. For example, you know very well that if you're talking about diabetes, you can't kill diabetes, right? It's not caused by an infection. You can't kill it. So the best way is to manage the symptoms. You take insulin injections for that matter, right? So you are managing the symptoms. You're controlling the blood sugar level via the medications, right? Another example is thyroid problems. You generally take a hormonal preparations so that your blood level of thyroxine is normal and it does the proper functions. Uh, how to justify prevention is better than cure? I will come to that, Shashank. I will come to that. Don't worry. Differences between AIDS and HIV. AIDS is a syndrome. HIV is a causative agent. Human immunodeficiency virus is the virus that causes AIDS, acquired immunodeficiency syndrome. So AIDS is a disease of the syndrome. HIV is the cause. Rabies is a virus which is transmitted via certain mammals like dogs. It's not a vector. Okay, now, so certain drugs also kill the cause, and this mostly works in case of pathogenic. So they work in case of pathogenic, generally diseases like bacteria, right? Rather, full form of HIV is human immunodeficiency. Pardon my handwriting here. I'm trying to be a bit fast. HIV. That's the virus, and acquired immunodeficiency syndrome is the disease. Okay, Aryan, I'm not sure what you're talking about. Okay, okay. So, if for pathogenic, we can have these simple drug treatments. For example, penicillin was a drug that was an antibacterial. It was discovered back in 1940s around, and the person who discovered it also got the Nobel Prize for the same. Right. Now, prevention. When we talk about prevention of disease, we understand that once we have contracted a disease, we have to deal with so many things. We have we also have to deal with the chances that it is transmissible, right? So it's better that rather than curing the symptoms, we can try to avoid it. We'll talk about that, Aryan, the drugs and virus thing. Okay, so that is why prevention is better. Now, how what are the principles of preventions? So the see we understand that our body has a well dedicated immune system. So our immune system is capable of fighting certain diseases on its own, right? So we have a native immunity that is already present in the immune system, and you also have processes that can be trained, right? So processes that can be trained by the process of immunization. So what is immunization? Immunization generally involves vaccines. Now, what are vaccines? So vaccines, Varun, give me some time to first cover through the chapter, and then we'll deal with the questions. Don't worry. Which part? Aryan, WBC itself is a cell. There are several types of WBCs. Okay, we have lymphocytes, monocytes, and several others. Don't worry about that right now. You don't have to deal with the types of WBCs. Now, vaccines are either dead or weakened pathogen themselves. So they are dead and weakened pathogens, or they are their secretions or parts. So what these do is they prime your immune system. So the job of the vaccines is to prime your immune system. Okay, so they train your immune system to launch a quick and a stronger attack in case you get the load of the virus or the pathogen. RBCs also are cells. RBCs, WBCs, they are cells, Ankita. They are, sorry, I think you told me your name, but I forgot. They are cells of the blood. They are present in the blood. Okay, cool. So that is how the immunization works. That you train your body, you give your body a taste of what the pathogen would be like, and the body prepares an army of attack. It prepares antibodies that target the pathogen in case of real attack, right? Inflammation, Soham, is one protective process which helps you to fight off or fend off pathogens. Or it also can be in case of damage to the, it can be triggered because of the damage to the body. For example, when we bleed, uh, you can imagine your the area getting swollen and hot because of that. Okay, it happens because of immunization. Okay, so this is the concept road that you have to take while dealing with the chapter. So you have to first understand the difference between health and disease. Then you have to understand the types, the modes of transmission, types of diseases, prevention, and the treatments. Acute diseases are like influenza, something that is caused for shorter duration. Okay. Now, what are the important topics that must be covered in this chapter? What are the principles of vaccination? The principle of vaccination is because is that it gives your body a taste of what the pathogen is like. See, imagine it like if you don't know who the thief is, how will you recognize him, right? But if you hand your guard a picture of the thief, there are very least chances that he will ever enter your house because your guard will spot him around. So when you give a pathogen, a weakened pathogen, such weak that he or she that the pathogen cannot cause a disease but is recognized by the immune system, that means it will prepare. It has memory. It will prepare the body for an attack. Next time when the pathogen comes, there will be a very quick and mounted attack. Okay. Now, yeah, I noticed it, Vansh. I'll try to not use. I will try to use your name in the sessions on. Okay. So, what are the topics that are important? In this chapter. So, the topics that are important are, remember, two diseases per category. Now, okay, how natural immunity comes from mother. Aryan, because during the process of breastfeeding, the mother transmits certain antibodies. Okay, they are called as immunoglobulins, IG for short, to the baby. Okay, so these help you protect from the diseases. Okay, now, so two diseases per category. That is, you should remember about viral, AIDS and influenza. You should remember about bacteria, right? Vibrio, that is cholera and typhoid. You can remember about protozoans, that is malaria and sleeping sickness. You can also remember about fungi, that is athlete's foot and ringworm. You can also remember, I think we covered all of them, right? Yeah. So you should remember two diseases each category. How does it affect the lymphatic system? Lymphatic system consists of the lymph and floating lymphocytes. Lymphocytes are a kind of WBCs that provide immunity to you. Okay, that is how they are involved. No, Vansh. The pathogen that is delivered is made in such a way that it cannot reactivate itself. It's either dead or just a part of the pathogen is delivered. It doesn't have the capacity to cause symptoms. Okay, Aryan, I just discussed about vaccination in the last few minutes. Okay, now name of the popular vaccines. You can remember at least one, like MMR, measles, mumps, and rubella is one of them, right? So remember one or two names like that. Distinction between health and disease. This is something that can be asked. Kshitij, signs and symptoms, as I explained earlier. Symptoms are something that's your understanding of your health. For example, you can say, I have a headache. I'm feeling hot. That's your symptom. But when you go to a doctor, he will measure a quantity. For example, he'll measure the temperature and say you are having a fever. So the temperature, the observable measurable quantities are signs, something that doctor takes objectively, whereas symptoms are something that you report. Rubella is another disease. Don't worry about that, Shashank. Principles of preservation doesn't come in this chapter, Aditya, right? Okay, now distinction between health and disease as we just discussed. Then vectors, important. Vectors and spread of infectious diseases, right? So several vectors as I gave, you should remember at least two, that is Anopheles, and you should also remember about the Aedes. These are all mosquitoes and they spread their respective diseases. Yes, symptoms are general understanding of your own self, Ekant, whereas signs are objective measurements. Okay, that is the Jatharth. Inflammation is the sum of processes that increases delivery of immunal responses to the target site. Why natural immunity is not capable to remember? Aryan, the answer to the question is there are different types of cells which are involved in certain kinds of immunity. You learn more about that in your 12th grade chapters. Shashank, think about it. Prevention is better than cure because when you're already immune, you don't have to deal with the disease, right? You're already immune. That bacteria or the pathogen will not be able to cause the disease in you. But if you get the disease once, then you have to deal with this with its symptoms. You have to take medications, and the diseases do have a chance of coming back again, right? If you're immune, you don't have to deal with all of that. Okay, so how does AIDS affect human? This is an important question which is kind of frequently asked. AIDS is caused by the HIV virus, and the HIV virus, they attack your immune system. They don't attack any other system, they attack your immune system itself. So you lose the capacity to fight diseases. So in normal case, your immune system will be able to fend off with tuberculosis maybe, but when a person contracts AIDS, those chances are reduced. Why antibiotics don't work against virus? Because viruses are very simple organisms, but they have high chances, high sorry they have high rates of change as in they are able to mutate at a very higher rate. So the medicines, the especially vaccines that you design, or the antibiotics, they can't kill viruses, because viruses they don't see. Most antibiotics either trigger the metabolism of antibiotics. They target the cell wall of the bacteria or the fungus. They target the metabolism, some or the other metabolic process in a pathogen, right? A virus has neither. A virus does not have a cell wall. A virus does not has a metabolism outside the living host. That is why. Okay, so it's very difficult to fight when it doesn't have anything, and it has high rates of mutation, so it can easily change the process that you're targeting. Okay, how is sleeping sickness caused? It's caused by leishmania, which is transmitted by the tsetse fly. Okay, now how is control of mosquitoes crucial to disease malaria? We know that the mosquito Anopheles, actually female Anopheles, is the vector for malaria, and we need to control it. That is why it's crucial. How do vaccines work? Vaccines are dead or weakened pathogens or their parts which invokes immune responses in our body, right? No, it's not a test, it's just a discussion. Name two diseases caused by bacteria. You can talk about typhoid. Who will give me another disease caused by bacteria? Come on, give me a disease that is caused by bacteria. Yes, that's correct. You can also talk about cholera, that is caused by Vibrio cholerae. You can talk about tuberculosis, that is by Mycobacterium tuberculi, right? Okay, so let's talk about the important points that we must remember while dealing with the answers. And what are those? So in this chapter, you don't have many diagrams. If in case, you should remember the diagram of the virus just to recognize it. Now the pathogens, so it's better that you show it like this. It's helpful. It says that you know your stuff, right? Use examples where possible. This chapter has examples, right? So at least remember two examples each. Follow mark plus one scheme. That means if it's a 2 marker question, at least write 3 points and one example. Very important. Do not forget to revise and practice your questions from question banks. Very important. Now, guys, see, one thing that I've noticed, something that people forget is canceling your answers. Let's say I don't want to write the word question bank. Don't do this. This is not going to fetch you marks, right? If you want to cross something, just put, sorry, put a simple cross against it, and that's sufficient. This makes the paper a bit more appealing to the examiner. Okay, so make sure you don't do such blunders in the examination paper. Okay, guys, so with that, we have come to the end. What types of questions? See, the questions that we discussed here, these are the questions that generally come from this chapter. Okay, so you can be asked about vaccines. AIDS has shown frequently in question papers, right? See, chronic diseases, it depends actually, Gaurav. Okay, there's no one universal answer. Okay, guys, so you can reach us again in through various forums that you already know about to know more with us. Okay, and so that brings me to the end of this sessions. In the next, we'll talk about the other chapter that just a moment. Okay, so I wish you all the best and good luck for your exams. Bye bye. All the best.